When you need medical care, you may find that the personal touch of a health professional that actually knows you and your health history can make all the difference. Inside Lehman's Jamie Blair introduces us to the world of the nurse practitioner.
Nurse practitioners provide the modern-day house call, the community health care that is now within reach and readily available in times of need. They bring the relationship back to a time when doctors and patients had a much closer one-to-one bond. In the busy healthcare system, doctors spend less and less time with each patient, and the nurse practitioner's job is vital to the healthcare of each patient. Students are preparing to provide medical coverage with a community focus as they work on completing their degrees in the Master of Family Nurse Practitioner program at Lehman College. The approach to addressing medical problems is a holistic rather than reactive technique. They examine how the body functions, but seek causes instead of just examining symptoms.
When you think about a person is not an arm or a leg or a headache. A person is somebody that lives in the community, has problems or has issues at home, issues, developmental issues, according to the age or stage that they are in their lives. So what we do is we look at the whole system of the person, and from there we give care according to their necessities.
That means learning to identify and read the many subtle indicators that are presented by the patient's symptoms and behavior. Human patient simulators prove to be valuable training tools, since these devices can mimic many of the patterns of human respiration and typical patient responses to medical treatment. Students gain greater insight and hands-on experience prior to working in a clinical care setting. They get an interesting glimpse into their future, looking at a simulator that appears to be looking right back at them. The skills they acquire are in great demand, especially with the Bronx having some of the worst health indexes in the nation.
We've got a rising rate of diabetes of women, Hispanic, particularly Hispanic and African American women. We've got increasing obesity in children here in the Bronx. We've got asthma, which is one of the common health problems throughout the nation, but a very severe problem here in the Bronx. And depression, which is something that we don't talk a lot about.
These students are developing their diagnostic skills in an advanced health assessment class. There is an added level of responsibility since a nurse practitioner has completed a master's degree or postmaster's certificate level work.
Open the drawer so you can feel the smoothness of it, or you go from side to side, okay? And you'll be able to pick out like a weakness, really. You really don't necessarily do this all the time unless there's a specific issue that you think is occurring with the facial nerve.
The nurse practitioner can diagnose medical conditions. The nurse practitioner can also prescribe medications where the RN cannot. The nurse practitioner usually does a very good holistic assessment for the person, as well as so does the nurse. Nurses are pretty well known for their assessment skills.
Residents will tend to overlook many things that the nurse practitioner will not overlook, and they are the ones who make the proper full assessment.
I'm working in cardiothoracic ICU in Montefiore Medical Center, and I did my clinical rotation for my CNS in heart failure. I would like to pursue heart failure for my NP and thus serve that population.
Once nurses have finished their master's level studies, as well as any additional training, they often apply their skills at various community medical facilities. One such place in which these additional skills are put into practice is the Mount Vernon Neighborhood Health Center. Located in the middle of a residential area, this center receives more than 200,000 patient visits per year for a wide range of medical specialties. The team also helps connect patients with other vital services.
Many communities don't have the kind of services that they need. Very often things like mental health services, dental services are really not available to the families. And we're very fortunate here in certainly having a dental clinic, and we're also very fortunate in having social workers, a child psychiatrist, and many other professionals who work with people with mental health problems.
The doctors and the nurses work greatly with each other. They meet my children's needs. They make me feel very comfortable. And I can always come to them and ask them anything.
When I began my pregnancy, they gave me great prenatal care. They followed up with my daughter as soon as she was born. She's now 7, and she still continues to use the health center. And her doctor, Dr. Joy, loves her, and they just accommodate her very well, and so do they accommodate me as well.
So, learning to be a nurse practitioner requires much more than medical knowledge. The profession demands that a person look at the big picture by being a good listener, remembering that patients are people first, and then brainstorming a solution with colleagues may be the most effective way to provide the best care possible. Jamie Blair, Inside Lehman.